Hey everybody, it's Matt Shu from Upright Health, and I'm here with Mr.
Josh. What's up, guys?
And today we are answering a question from a viewer, Mike. I believe it's Maika Swedin, uh, and Maika basically sent us a message about her arches and bunions and knock knees, and so she's had some trouble over the years with.
Do you know for sure it's a female?
I'm pretty sure Maika Swedin,
I've met a guy named Micah.
Maika.
Hmm.
All right,
What do you
so
guys think?
vote yes now. Um, click the left mouse button if you think it's a man. Click the right mouse button if you think it's a woman.
We'll go with a woman.
Scores are in. Scores are in. Oh, it's 50-50. We're just gonna go with.
Jeez.
We're just gonna go with. How often does that happen?
Go with what you started
On
on.
the internet, it's crazy. So we'll just go with woman. Might be man. I don't know, but we'll say woman. Okay, so Micah has struggled with fallen arches and bunions and did a bunch of things to actually help. So Micah has changed to shoes with a wider toe box, has been doing exercises like the short foot exercises are arch raises, toe scrunches, ankle inversion and eversion with a band, and is doing calf trigger point massage, and it has worked well, which is awesome. The big toes have straightened back out, and the arches seem to be higher. The question is, what else can Micah do? Micah has knock knees and has been told that she or he needs to do some glute medius exercises to help bring the knock knees out. Mike also says, I carried a lot of weight at one time that probably affected my knee ligaments. I don't have pain, but my knees look weird. Is there anything I can do to reverse it or minimize that? And failing that, is there anything I can do to strengthen and protect my knees? So there's a ton of stuff in this question. So we're going to try to go through a couple easy ideas. I think in general what the PT said is pretty much correct. And anybody we've seen with valgus stress or internal rotation will probably do things that do fall in line with what your PT said. One quick thing we want to talk about is the difference between valgus and internal rotation. So valgus stress is kind of hard to show. So Josh, can you show us your valgus knees? Right. So, and I'm gonna try to show you, and I can't really. So the problem here is, so valgus knock knees, like true knock knees, is basically when your femurs come in and then your tibias go out, right? So that's where you get that X pattern. So that's actual true knock knees. The thing that accentuates knock knees is femoral internal rotation. So this we can all do, and now it looks like, yes, I have knock knees, but the knock knees situation is actually, this knock knees situation is more driven by the internal rotation rather than actual adduction of my femurs. So that's one thing to think about. If you have knock knees and you have valgus stress, that's having to do with adduction, and internal rotation like this is another plane of motion. Now, what you actually do about them is not going to be that different, but it's good to have that separate in your mind. So in case you do have a big internal rotation issue, you can really focus on addressing that internal rotation rather than continuing to think about abduction. Sorry, the other thing I want to mention is, Josh, can you take your, actually, no, that should be fine. Just go ahead and face them, and then can you kind of show them collapsed arches? Okay, so if your arches are collapsed down like that, that's also going to adduct your femurs, may internally rotate your femurs a little bit. What happens when you squeeze your butt muscles? Can you maintain your fallen arches when your butt muscles are squeezed?
Nope. Not at all.
Not at all. So when you squeeze your butt muscles, it's going to turn your femurs externally. It's going to rotate your femurs externally. That's what your glute max will do when you squeeze them, when they're contracted. So when your glute max muscles are stronger, they will often help maintain better arch position. because your glutes are now pulling your femurs out this way rather than allowing everything to fall in. So that's actually one thing over the years that we've seen is training the glutes really does help not only with the knee position, but also with arch position.
Brings everything up. Yeah.
Brings everything up. So things that you can do to train better glute activation and knee positioning are, like your PT said, things that deal with glute medius, also glute max, to really help encourage abduction and what's the word I'm looking for? External rotation. Yeah, thank you. So for that, one really easy exercise you can do is get a band. These are mini bands from Perform Better. You can get all kinds of these elastic training bands all over the place. You want to put that on, Mr. Hash?
I've been waiting to see what we're going to do with this.
Yeah, he's never seen this exercise before.
You're holding it in your hands the whole time. I was like,
what's going to happen?
Are we going knees or ankles?
Let's go knees and, well, Josh likes it.
Like it all scrunched
He
up.
likes it scrunched
It's
up.
actually a personal preference.
If you're doing this at home, you might want to keep it not scrunched up so it doesn't cut off circulation. But
Yeah.
it also makes it more likely to break. But if it does break, we're going to take it out of Josh's paycheck.
Yeah.
So
That would be cool to get caught on film now. Strong glutes to break this guy.
he can't do it. So what Josh is going to do? Well, why don't you walk us through it, Josh? Why don't you show us the crab walks here, or sometimes called monster walks?
Yeah.
So.
For sure. I'll start on this end of the screen here. And so doing a crab walk, monster walk, what we want to do is so I have clients, we can either do this in more of an upright position, or we can actually start to kind of hinge down at the hips here, right? Now you can do this as a whole spectrum here, right? What I'm going to show you guys is just a bit of a hinge here, okay? So I'm going to keep my stomach tight here to make sure that my pelvis is in a neutral position, because we need the pelvis in a good position to make sure that these muscles that we want to work are going to work correctly, okay? And that's going to be these lateral hip muscles, all right? So from here, I'm simply just going to lead with this foot. I'm going to take a small step here. We're getting hip abduction, and then just going to pull myself over, okay? So hip abduction, I can feel these lateral hip muscles working to do that. And then we're just going to basically just work our way down this way.
I think this way works.
Okay.
Welcome.
All right, go a little faster.
There's a bowl here. Easy.
All right, now I'll just come back. Yeah, anything to add on this, Matt?
So just one thing that Josh kind of touched on is that hinge often is quite helpful. If you don't hinge, sometimes you're not going to feel your glutes working. Sometimes you'll actually be able to compensate with your lateral quads, IT band area, or TFL. So a lot of times having that hinge is absolutely necessary to hit the right musculature. The other thing is probably the knee bend, right?
Mm-hmm.
So knee bend, if you bend your knees too much, this becomes
kind of a weird.
Yeah, it's a big quad exercise.
Yes.
So really focus on feeling it out here. Was there something you're going to mention about?
The last thing I was going to mention was just trying to keep the feet pretty straight, right? We can have a little bit of a toe out, but if we start moving like this, we're going to be compensating with other muscles if we're kind of in this duck-footed position.
Right. You start getting the hip flexors and the quads again. So you really want to make sure you focus on getting butt muscles in there. Another variation of this too that you can do is just right into that same starting position and just focusing on the abduction and external rotation. So something like this. You can see when Josh is doing this is actually lifting the arch off of the floor a little bit. So that's also a good way to just kick in the glute med, glute max, some of those little tiny hip muscles out on the sides. You can do that, like if you're doing it in this method, you can probably do this like 15, 20 times, 30 times, or just set a timer for 30 seconds. Just do it one side and then do it on the other side. So that's one really easy exercise you can do. Just need to get a rubber band. You can pretty much get them at any sporting goods store, or just order them on what's that website? It's like about a jungle or something.
A jungle?
Yeah, like Amazon. Yeah. You got stuff. You can go online, check that out, and that exercise is super easy to do. Josh is using, I think, a heavy resistance band. If you're just starting, usually you can get away with a medium or heavy. But if you've like really not done much exercise for like 30 years or 40 years, you may want to start with lighter band, the light resistance, just in case your hips are pretty weak.
Yeah.
Yeah, so we're going to show you one other exercise that you can do for your hips. The other exercise we're going to show you is actually a single leg Romanian deadlift. It's an exercise that we really like a lot because it focuses on both coordination and strength, and it also definitely helps you learn how to control your femur and control the rest of your body in relationship to your femur so that you can, over time, minimize that kind of collapsing of your arch and internal rotation of the femur. It's one you probably haven't been told to do in combating this, so that's why we're sharing it. We're also assuming that you've been shown a lot of other gluteus medius exercises, so the ones that your PT has shown you are probably pretty good. We're going to assume that they're good, so we just want to show you one that's a little bit harder, a little more functional. So single leg Romanian deadlift. Josh, if you want to demonstrate that while I grab something over here.
Yeah. So what we're going to do is we're going to square ourselves off here, and I'm going to be planting on my right foot. Hopefully I can complete this. I just got a little nervous because it's showtime now. And I'm going to bring this left leg straight back as I hinge forward to the ground. Boom. And then I'm right back up. Okay, now what we want is for this knee to not be diving in. If this knee is diving in, that means that we're not activating this muscle that we were just previously talking about activating, okay? So I need to make sure that my knee is tracking my toe here, that muscle is doing its job, and I can come up and down there, right?
Yeah, so side angle. Yeah, that side angle, right? So Josh is talking about getting these muscles on, right? Getting the glute max on, getting the hamstrings on. You want to go ahead and show them.
Yeah.
So you can see from this angle also his spine stays pretty straight. He's not going to go into any big arch. He's not going into any kyphosis. That leg is just going back. The other thing to notice is that his right knee, the one he's on, is slightly bent. It's not a super big bend. If it's a super big bend, then this turns into a very different exercise. But by keeping the knee straighter, maybe with just a 5-degree bend, you make sure that the hamstrings and the glutes are getting a lot of the work in this exercise. As Josh mentioned, you want to make sure that the knee is not collapsing in towards the midline. That is exactly what we want to fight. And to fight that, you use your glutes and hamstrings. So if you feel yourself wobbling or you feel that knee going in, you want to really try to squeeze with the glutes and hamstrings. Now, if you find while you're doing this that it's way too hard and you're just like, you're falling over and all that stuff, then you can use something like a foam roller. You could use a pipe. You could use a table. You could use the wall.
You can use your friend.
You can use your friend. Inappropriate for the internet, I think.
Hopefully it's a girlfriend.
People are going to see this. So the secret's out. Again, Josh is showing you just use this. And then as you get better at doing this exercise, you can use less and less support. So one thing we like to do is just have people kind of tap on it or just use a finger on the support. So that way you can't use that much help from that device. And then once you feel comfortable, you just totally stop using it. And you can do sets of like 5 to 10. And once you can get through like 3 sets of 10 pretty easily, then you want to start using weight. You can start putting weight into your hands and going into it like that and coming back up. But that's once you've got the simpler version done first. So hopefully that helps you out. Maika, whether you're a man or a woman, we don't care either way. We just hope it helps you. And we hope you remember that pain sucks.
Life shouldn't.